is Dr. Godiya Ishaya. I'm the National President, Nigerian Association of Resident Doctors, NARD. I'm a cardiologist in training from the Abubakar University Teaching Hospital, Bauchi. I came into office in the wee hour of 26th of September 2001. And since then, I've been the occupant of this exalted office of the President of Nigerian Association of Resident Doctors. That's for the past 4 months, or going to 4 months now. Came into the office and inherited an ongoing industrial crisis. And we were able to meet with all the relevant authorities, and we got it behind us with the hope that we were going to continue engagement with the government, as most of the issues before we suspended the strike were work in progress. And with one of the issues is the issue of the hazard allowance that you just made mention of. You see, the truth is that the Nigerian Association of Resident Doctors is tired of having to declare actions or always coming on the negotiating table in order to try and see that we negotiate on things that will lead to better healthcare delivery in this country. We had quite a negotiation with the government regarding the hazard allowance. A lot of sittings even before I came to office. And when I came to office, we had a lot of engagement. At a point, the negotiation for the hazard allowance was a joint negotiation for us to come up with a collective bargaining agreement with the government, which will be implemented. But because of obvious differences regarding what the doctors does and other health workers, the negotiation could not be done just jointly, and the government had to balkanize the negotiation into two. They had several sittings with the Joint Health Sector Union and with my union and the Nigerian Medical Associations. And we made it categorically clear to the government that, one, we don't want to come back anytime soon to be on the negotiating table regarding this hazard allowance negotiation. So we put a proposal that in order not to do that, we believe that we can tie the hazard allowance to be a percentage of our basic salary, which we have noticed, if you can also bear me witness, that aside from this hazard allowance, there has never been an allowance that had generated hit like this. Why? Because all of them derive their spirit and inspiration from the basic salary that we earn. So what that translates to is that whenever there is negotiation on salary, those part of allowances that are incorporated in our salary will automatically be adjusted. So we needed a situation whereby the hazard allowance will also derive its roots from our basic salary as a percentage of our basic salary, so that we don't need to come on the negotiation table anytime soon to come and start negotiating with the government. So we made it very clear that the fundamental error we have observed with the hazard allowance is that it's not a percentage, or it's not deriving its root from our basic salary. And as such is the reason why we're having this problem we're having. Because when it was pegged, sometimes in 2009, when it came to life, at that time it was, nobody was complaining about it. But as the economic reality keep on changing, and the basic salary and other attending emoluments that derive their source from the basic salary keep on changing. The hazard allowance remained the same. And it came to a point based on the reality of the economic on ground. Even the government themselves admitted that that was nothing to write home about, and hence there was a need to adjust it. So we said if we really want to adjust it in order to be just in tandem with the other allowances that we earn, that should also derive a root from the basic salary. And to our amazement, the government went and agreed with the joint health sector union of a flat rate, and then it was imposed upon us even when we have clearly met our position that irrespective of the amount of the money that the government is willing to pay on that hazard allowance, it should derive its root from our basic salary, so that clearly we don't want to come back anytime soon to engage the government on the negotiation regarding this hazard allowance. But it was quite unfortunate that the government went the route they went, and we felt it would not be acceptable unto us, because if we accept it now, in the very near future, we'll have to come clamoring, and it may even lead to industrial action before we will get the government to the negotiating table again. And whenever we are on the we are on industrial action, we know that the masses do suffer for it, most especially those who don't have the wherewithal to fly their wards or themselves to neighboring or advanced countries for healthcare delivery. So it's in this spirit and this thinking of ours that we believe that it shouldn't be accepted. Let's remain on the negotiating table. Let's agree on something that will be more enduring and that will avert future crisis in the health sector. So that was the reason why my association felt we shouldn't accept it and we should reject it, and that was why we rejected it. Well, it's because we don't want to get to a point of having to think of next plan. That is why we are taking this posture from day one, so that the generality of the public will understand that we are actually proactive minded individuals, and we believe in trying to solve problems before they even arise. So we have put this in place because in the first instance, the hazard allowance that it is, there has never been a time whereby negotiation will take place between the government and the unions, and there won't be signed collective bargaining agreement, which whatever circular will drive it inspiration or it root from. So this is what had happened, and accepting it is very prone to having more crisis in the future. And because we don't want to allow such situation to arise before we will come and be grappling of, okay, how do we get out of it? We want to see that even before such crisis arise, we have actually worked in nipping it in the bud. That is exactly the position of the association, and that is what we are looking out for. Because whenever there's an industrial action, people may not be privy to the informations that have led to the industrial action. Why? Because as at that time, you find a lot of emotion being attached to someone, want his or her relative will be taken care of, and go to the hospital and discover that the health workers are not on ground. And the problems usually get their root from very, very preventable position. And this is one of them, just as we have identified. And well, we have been advocating, just as I said. Industrial action is usually the last resort that any association will have to embark upon. We never felt it will get to a point whereby we'll have to declare industrial action. Since when there was no epidemics, pandemics, we've been advocating for it and a lot of other issues. But the government never paid attention to it. And it got to a point whereby we felt our members were dying from infectious diseases and pandemics, which we have to grapple with in order to bring to halt or mitigate the suffering on our people. So it started with Ebola first. When Ebola came, you'll bear me witness that the first victim was a medical personnel, a doctor, Mrs. Stella Adedevo of blessed memory. She had to sacrifice her life in order to prevent the infection from spreading within the country. And we have had to grapple with a lot of other infectious diseases like Lassa fever, Marburg. Now, when the COVID-19 started, the whole world didn't know the epidemiology of the disease. We have to grapple and be thinking. And in the midst of this, the health workers, frontliners, and doctors in particular, had to lay down their lives, sacrifice their life, and we have lost quite a number of our colleagues due to the fight. And we discovered that as an association, we need to push the government to be able to give us at least something for the risks we are taking, to be able to mitigate. We know that there's no amount of money that will be paid to replace the sacrifice that we have been offering. But however we felt, at least if you are rendering service, you should be appreciated for the services you are rendering. How do you appreciate? When you are ill, you should be able to have the resources, or the resources to be able to take care of yourself, or at least to some reasonable degree. So we agitated that it has to be improved, and that is why we had to come up at the time we came and started agitating. And if you have followed event very well, you observe that the agitation actually became peaked in 2002, where we had to go on strike to drag the government on to the negotiating table, and then they accepted the fact that the hazard allowance being paid were not in any way commensurate to the risks that we are taking, and they agreed on an interim measure of giving us a special COVID-19 hazard allowance to be able to mitigate the financial hardship that we had to undergo when we come down with these infectious diseases. So, but we needed to have a permanent solution to it. That is why the agitation continued, and what had culminated or led to the new hazard allowance that we are having now. To be sincere, I would say that for the rich, the poor to have a quality healthcare delivery in this country, we have to have strong legislation that will back the healthcare institution strongly, so that all of us will be able to access healthcare in the country. I can tell you that the problem of healthcare delivery in Nigeria is never from the expertise of the healthcare workers, because these have been tested. It has been proven beyond doubt that you can see that year in, year out, a lot of people from developed countries and the Middle East come into the Nigerian system, health system, to poach our doctor or lure them into accepting employment into their country. And I can tell you, whenever they come looking for doctors, they prefer those that have certificate, the doctors that graduated from the Nigerian universities, not those that graduated from the foreign universities, because they know the teaching and the training of Nigerian doctors is very, very, very adequate. And in fact, the kind of training that we're receiving, most of the world are going away from it, but we have stuck to it, and it has so far made the Nigerian trained doctors to be the envy of the whole world. Wherever they go globally, they are accepted and given such recognition. But we have a very weak institution and weak health facilities that is not giving us the environment as the health workers to be able to operate and give the best we can. And if you look at it, what I always believe is, if we can have legislation that will make all and sundry within this country to assess their health system within the country, that will force the policymakers to improve on the health system. There's no shortcut to it. I believe that there's no coercion and there's no other way to go about it, rather than those who are at the helm of policy making should be made to attend the health system in the country, and not only the health system, including education. Because the truth remains that whenever or wherever you access your health care, you want such facilities to be improved upon, and you want that whenever you are there with any form of condition, you are given the best that you should be given. Without that, I believe that we'll continue to grapple with the poor health indices, and also grapple with the poor facilities that will have to be struggling on making use of to give healthcare services to those who may present themselves needing it. And that will not in any way change the system much, but as I said, strong legislations and also good policies need to be put on ground that will help develop our health systems. Truth is what I just finished saying. You cannot execute when there are no proper legislations. And the executives, just as the name is implied, you are executing what have already been legislated or have been put in place. And if there's nothing tangible for you to execute on ground, then definitely there will be problems. I still will want to go back to where I was, because you know the natural thinking of a human being is that as long as I have what is given, what I can take care of myself, Human beings, I can say, they are naturally kind of selfish also. If the executive feel at any time the government of the country can be, or the country can be able to give me what I need to travel wherever I want to go and fix my health when I'm in need of it, then the drive toward declaring state of emergency or doing other things may not necessarily be there. So, but if there is a feeling that I don't have any other place to run to, just take, for instance, when this COVID-19 started, some highly placed government official admitted themselves that they never knew that the health system was this poor. Why? Because they have never attended it. So whatever they do, they never put it at the back of their mind that it was in that deplorable state. But when the COVID-19 now locked everybody down, and they had no other places to run to rather than attending to their health needs within the country, they now begin to notice some of the things. So that is why I still have to go back and say that without proper legislation or without proper policies being on ground to ground everybody onto attending to the health system within the country, I can tell you we'll only be doing lip service to our health system, and things may not move the way it should move, and the executive will not have the will, the political will, to be able to do that because they are not held accountable or they are not being pushed to do it. And so you have the fact that they have incentive going to wherever they want to go to seek their health needs, and then there's no pressure from their electorate to push them toward that. The will may not be there. And at this point, I must say that I sincerely want to thank the media. It's like the media have beamed their searchlight on the health system. And that is the way to go, with continuous engagement and continuous enlightenment of the populace. The average Nigerian will come to understand that actually we are not doing anything to the health system. And without putting much onto the health system, then I can say that nothing will move in the right direction as one, because health is one of the critical sector of the economy. Without the health system being in very good shape, you will be assured that all the other aspects of the economy will suffer. Just a clear example is this COVID-19. We don't have a very good system to control the COVID-19. You don't have vaccine producing pharmaceutical companies within the country. Then you'll be rest assured that the economy will always be in confusion, because there will be fear of contracting the disease, and we have seen it practically operating within the country. Believe that there are always push factors or reasons that are pushing those who seek to go to other countries where they have things that are pulling them to go to those countries. And some of them are what I mentioned. For instance, I'm a trained cardiologist, or I'm being trained as a cardiologist. And the dream of every doctor is, because the satisfaction a doctor gets is when you are being able to give the patient the desired treatment that the patient requires. Let me give you an example. I have been training in the hospital that as a cardiologist, some of the things that I will require to treat a patient when they come and with a condition that can kill them first is heart attack. So when individual come with heart attack, it require some intervention, and those intervention is what will save his life. And this person come with a heart attack, and not that I don't know what to do, but I don't have the facility at that particular point in time to be able to save this person's life. It gives us dissatisfaction from our job, and whenever I have the feeling that I can go and have these facilities somewhere to be able to practice my profession with dignity that it deserves and with satisfaction that is required, I'll be willing to go there and do it. Because when you do those things, just as it said, medicine is just not only the science, it's the science and the art. So the art aspect of it is how often you do it. As you do it, you improve and grow in the profession, and you'll be able to discover a lot of things. So those are some of the things that make most of us want to go out. Then also, this issue of improvement in the welfare, the health, the welfare. I can tell you it's only in Nigeria that you have doctors having to fight, and then when they are fighting for improved salary, you have other health workers coming. You don't have much of these things where in most of the climes or the countries that these people, these our colleagues migrate to. So you have this feeling that I have been given much to the society, but I keep on being compared to others, which their services are also essential. But that is not being fair. It's just like now, a legislative or a pilot is working in the airport and drive plane, just like any other worker in the airport. And then you are comparing the pilot job with any other person in the airport. It wouldn't be fair to the pilot, and that will not make the pilot give in his best. So those are some of the practical things that happens that made people to become dissatisfied and disenchanted with the whole system and want to go out. Aside from this, we have so many other reasons, the economics reasons. Yes, the pay they will receive there is far more than what they will have to receive if they are in the country or they are practicing in the country. So in order to put all these things into check, we have to consider all these things. And some of the things are inevitable, some of the things are beyond the happenings in this health sector itself. For instance, insecurity. If you're practicing where the environment is not secured, you're always afraid what will happen to your family, what will happen to your life. And whenever the opportunity presents itself for you to move out of this country, you will want to move out. So, as you can see, the problems are ranging from those within the health sector and those outside the health sector. And those are the reasons why people would prefer to go abroad. But I believe if the health system is fixed, most of the people, most of the Nigerians, most of the Nigerians I know, will prefer to practice their profession within the country. Well, we have been able to achieve a lot within this short period of time we have been in office. We have been able to give our members their allowances of medical residency training, which was becoming a serious problem that we had to go on strike. We have been able to give them back those allowances. We'll be able to get those allowances from the government paid to them. We have been able to as well get the withheld August and September salary paid to them, not only to them, including the one that was withheld for the health or the other health workers. Sometimes when they went on strike, I think in 2004 or something. And during our negotiation with the government, we got it released to them as well. We have been able to expand on we've been able to expand on what my predecessors did before they left, and we are hoping that as we go to as we enter this new year, we'll be able to improve more of their welfare in order to see that the brain drain that we are experiencing is reduced to the barest minimal or even reverse, as the case may be. And above all, we want to see that the health sector enjoy peace if the government also reciprocated in our gesture and the way we have been trying to push most of the other remaining problems or other issues that have been lingering with the government.
COVID-19 is already with us. We are having different variants at this point. What advice do you have for Nigerians?
Well, the advice I have for Nigerians is to continue to practice the non-pharmacological preventive measures, like always mask up when you are in a crowded environment. Try as much as possible to wash our hands with water-based or rather alcohol-based sanitizers or water and soap for at least 20 minutes. Also, whenever we are in crowded environment, we maintain social distance. Try as much as possible to get ourselves vaccinated, because the vaccines are everywhere now. Even though may not provide 100% protection, just like any other vaccine, but we're sure that with the vaccination, the help of the fear of having a very severe disease may not be there again, except if one has other immunosuppressive conditions that may not even make the vaccine to work on them. So by and large, that is the only advice to give, because the virus keep on changing. Whatever mutant form one will get infected with. It is the belief that if you have been vaccinated based on science, you will reduce your chances of getting a very severe disease from whichever mutant that you may have to be, or that may infect you. So basically, and also to add that the vaccines have been proven to be safe, and they don't contain any magnetic chips, as people have been saying. There are a lot of misconception about it. Say those are just made up stories to scare people from getting it. Myself and any other health workers, we have all been vaccinated, and since when we get vaccinated, nothing have happened. In fact, nothing have changed. So let's get ourselves vaccinated.